AM Impact on Your Health is sponsored by Dennis J. Courtney, MD, Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health, heard every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in. Today, well, I'll tell you what, folks, my phone's been ringing off the hook since last week when we had Cass Ingram aboard. I actually called the company and said, we want Cass back. In fact, we are tentatively scheduled to have Cass this morning. I'm hoping we get to pull it off. The subject of oregano has really permeated my office. Your phone calls have told me you have an interest in it. And, well, the king of oregano is Cass Ingram. We're going to try to do that right after that first break. I was told by his wife that he was on his way to the office. No answer yet. Hopefully we will be able to connect with him. Now, look, if we connect with Cass, well, the show will go pretty smooth, and you'll be able to call in and talk to him directly at 412-825-6262. If we have to switch our gears, all that means is Cass will be with us on Friday, and we'll pick up where we always leave off, allowing you to come and set that agenda today. 412-825-6262. You are very resilient listeners. You tend to go with the flow, and the way we handle this show, well, you have to. 412-825-6262. We'll try to establish our contact with Dr. Ingram right after that first break today. Now, speaking of upcoming shows, like I say, we're either going to have Cass today or Friday because I didn't talk to him directly, and I'm working through an intermediary. I'm a little worried about how this is all going to go, but nonetheless, 22nd. Next week, right now, I have nothing scheduled, and hopefully we'll have something by the end of the day today. Ed Condrot, Dr. Ed, is going to be with us on the 22nd. That's a little over a week from now, but nonetheless, want to get you ready for him. He's coming to town. Going to put a big seminar on out at the airport somewhere. I think it would be the Airport Marriott. Still don't know for sure. But it is, I do know the dates, on the 21st of March, which is a Sunday, a free seminar, to be followed up on Monday, Tuesday, and Wednesday by a treatment seminar held at that same hotel, that same venue, where we'll actually do these non-conventional therapies, get you started on your treatment regimes. I'm going to be back to Pittsburgh to check on you. Because, well, he's just come through so much now. It's going to be 3 times a year, or at least he had it scheduled for twice, and it has sort of burgeoned into 3 times per year. Dr. Ed will be with us on the 22nd. Looking at the calendar as we flip to the month of March, I've mentioned already, I got Raymond Francis coming aboard. I know he's been on some local radio shows because although I didn't hear them, I've heard reverbs about his presence on them. He's written a new book. I'm dying to find out what he has to say about cancer treatment, and the like, which is the title of his new book. The actual title I don't know. I know the subject is cancer. Of course, I always know the title of his previous book because we had him on our show talking about it many, many times, called Never Be Sick Again. Raymond Francis to be with us on Wednesday, the 3rd of March. And, hey, that's pretty much, of course, I have mentioned here Dr. Condrat coming in town on the 21st of March. So, that's the way she goes. Look, enjoyed the show with you on Monday. Talked a lot about the cardiovascular component of what we do here. I get calls afterwards saying, hey, you know what, that really cleared up what you guys really do, and I appreciate the, I'll call it softball question I was thrown by one of our listeners, and it allowed us to really expand on that cardiovascular um, offering that we have here at the office. Of course, Dr. Oliver Caminos comes today. That was the mention that I started out with on Monday's show, talking about his return. He's finally back in the country, and he's here for a while, and he comes to our office 2 times a week. I mention this to you because you may very well, and you probably should, especially males over the age of 50, women postmenopausally by 5 to 7 years, absolutely too, need and should have a very extensive cardiovascular workup. I think in one of the up-and-coming near shows, we should talk about how extensive that workup really is from the viewpoint of the cardiologist himself, and having spoken to him frequent about it, he enjoys coming on the radio, and I know you enjoy hearing from him. So I just wanted to mention that to you. The cardiologist back today comes here each and every month, 2 times a month, every other Wednesday. And so if you're out there and you're thinking, you know what, maybe I sure would like to be evaluated by that guy. He is a board-certified cardiologist. This is a completely insurance-covered, well, thank God, too, because it's pretty expensive workup. Insurance covered all the studies, all the labs, evaluation by Dr. Caminos, history taking, and the like. And of course, too, if you're interested in how we can glom onto that, which is usually what precedes, usually come to see me first. We talk about our plan. You now know that the plan here consists of those 4 words, and I'm going to keep mentioning them because I think I had never done so before. It cleared things up the other day. I say, look, there's 4 real advantages here in terms of your cardiovascular health. Things that will not get done by your conventional doctor, not because he even doesn't want to do them, because in many cases he just doesn't know they can be done at all, and unfortunately doubts that they are able to be done because it's something that just doesn't come up in he or she's training. Anyway, those 4 words, and I'll keep mentioning to you, be pop quizzes on these frequently by those who call in. Inflammation and how we put out the fires by checking on those 8 lab tests that have become so famous now. Every time I see people, they go, hey, could you write down what those 8 lab tests are? And I just stop and I go, okay, I'll do that for you. Putting out the fires by dropping the values of whatever one of the 8 parameters is out of whack. Number 2, the second word is plaque, that fiendish little devil of a problem that begins in men, unfortunately, way too early. And in women, I wouldn't say way too late, but fortunately, they really are devoid of any of this plaque deposition all the way up to menopause. And the chelation therapy, this is something that the conventional medical community doesn't really feel is possible, yet it is certainly has borne itself out to be very possible over the many years I've been knowing it. The third word, flows, and how we redevelop flows and build a brand new set, spanking new set, I should use the term, brand spanking new set of blood vessels around all the organs, the heart, yes, brain, kidneys, liver, lung, you name it, through a pretty miraculous procedure that, although it is conventional, although it is FDA approved, although it is insurance covered, is really tough to find in the cardiology community. It's called ECP, stands for external contrapulsation. We've talked about it before. Up and coming shows, we will reintroduce it again. And then finally, the 4th word, remember now, first is inflammation, 2nd plaque, 3rd flow, 4th is clots. You've got to break up these clots from the blood that seeps around from the plaque that gets deposited. Plaque is nothing more than a God-delivered Band-Aid that covers a wound on the inside of an artery that's due to injury and damage from inflammation. And there's still bleeding that occurs around there, and that bleeding forms clots. And those clots, if they should abruptly break loose and occlude a blood vessel, that's what causes the events. And the events are things like, well, if it's in the heart, an event is called a heart attack. If it's a brain, it's called a stroke. And if it's any other place, it's just called a plain old infarct. But nonetheless, it is something that can be and should be dealt with. It can't be dealt with in the conventional world because they have no mild clot busters. They only have major league clot busters, and excuse me, thank God to have them. But nonetheless, TPA, which is the name of the substance given intravenously in the throes of an event, is material that's can't be taken ordinarily on a daily basis. So mild clot busters, things like nattokinase, things like lumbrokinase, these are the ways you end up busting up clots and get protected that way. Sliming platelets, which the conventional medical community will do, has done, continues to do, uses drugs, however, to do them, things like Plavix and Persantine and the like. We get equally good sliming, and you don't need to use a drug. You can do so very well with standard supplementation and put as much a layer of slime, if not more, on platelets and get that protection too. So there you have it in a nutshell, just a couple-minute recap of what our show was on Monday. Hope you enjoyed doing it, and of course always would love to field questions on this matter. Come on in to see us, give us a call, set up an appointment. We'll see and discuss all those items that draw a pretty clear picture in your own mind about how things should go here with respect to your cardiovascular status, and then have you moved off to see Dr. Caminos, and then zinged right back to me whenever the evaluation is complete. So, enough on that. Well, here's what I'll do. I'm going to take a short break. In the interim, I'm going to try to locate our Dr. Cass Ingram, see if he's arrived at the office or not. And if he has, hey, we're going to be talking about oregano today. If he hasn't, we're going to be talking about oregano on Friday. And we'll open them up to you today. I got some other reasons why my phone's been ringing off the hook in the office. It's called holographic chips. I'll give that information out because the patients said, please give that information out on the air. So I'll do that. Be right back in a moment, hopefully with Cass. Maybe not. Be ready to switch gears.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Have you been to the doctor lately? Was fatigue top of your complaint list? Even if your doctor asked you what you eat, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Fruit of the Spirit. The blessings of Fruit of the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith. Let Fruit of the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
Hey, good morning, everybody. Welcome back once again to M Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you live today on a pretty cheery day. Snow just not stopping, folks. Just keeps on coming. Every time I go out to the car, got to clean it off. I know you're going through the same thing. Keep it up. We're going to emerge from this by the end of this weekend, I'm told. But what has it been up till now? Look, couldn't find Cass. Either hadn't arrived at the office or hadn't been informed that we're going to meet today. So unless he gives a call to the station, I know the station has that phone number too, and we'll keep on trying. We may end up clicking, and we may not. And of course, right now we're going to say we have not, and we open them up to you. This show now changed. It becomes your show. The number to get in here to ask any question you have on your mind, any comment you want to make, 412-825-6262, 412-825-6262. And as soon as I hear you knock on the door, I will let you on in the store, and we'll see what's on your mind. I want to raise a couple things that cause you to call the office and evidently still haven't been clear. The one thing I think that the calls are getting less on it, and it has become clear, is this thing called Fruit of the Spirit. Many of you out there, of course, you come in the office, you get a free swig of that stuff, and I think the taste test is tough to ignore on how good this tastes. This stuff is a mixture of 14 biblical fruits, purees, as well as alkaline minerals from the Dead Sea. Alkaline meaning, hey, all the minerals in the sea salt are found in that sea water, and they're all available in Fruit of the Spirit, as well as a additive called resveratrol, a pretty well-known component from the skins of dark grapes that have tremendous benefit antioxidant-wise. Anyway, they're all found in Fruit of the Spirit. You keep hearing commercials that Deborah Ray has recorded for us, and she gives you a number, that number 800-442-3793. That's 800-442-3793. Give it a try. I think you'll really enjoy it. The price slash on the Fruit of the Spirit now at $29 instead of $39 when it first was introduced here, is I believe something that well, just makes it all the more enjoyable and certainly more economic for you in the tight budgets that you have to operate from. The other thing that we have been barraged by it, and it just keeps getting messed up in terms of you utilizing those computers. There is no 800 number for these holographic chips. Now, we had a show on this with Dr. Potts. See, when he was here with us, looking at that, he was with us on the 6th, Friday the 5th, Friday the 5th. And the 3rd. Hey, he was here 2 days in a row, 3rd and the 5th. And we talked about these holographic chips, and I thought he was quite the expert giving us the basis for how they work. There are 3 chips made by this company called Ciara. That's C-I-E-A-U-R-A, Ciara. And they work on an acupuncture or Oriental medicine principle of balancing energy on the meridians. 12 meridians that the Orientals have for centuries now, thousands of years, some 4,000 to 5,000 years old is this form of medicine, utilizing needles called acupuncture needles to help to balance. I keep saying, and I think because I've been intrigued by acupuncture, I've been a student and a devotee of it myself, that the precision by which these acupuncture needles have to be used is extremely difficult to learn as an art. And the chips help take that out of it. There's a 4-inch square, not millimeters, 4-inch square of surface area that you can operate under to place chips for a pain problem, a sleep problem, and an energy problem. Now we have a knock on the door, and the moment we get done with that caller, I'll come back and I'll talk to you about the website. Get a pencil and paper ready, because there's trouble out there, folks, and you're getting this website. People keep calling the office and say, would he give that again? And I will give it again. And let's let this caller come right in now. Come on the store. Hello and welcome aboard. Hello. Hello out there. Did I scare you away? Come on back. 412-825-6262. Maybe Barry can scare him up and bring him on back to the store. Well, did you get that pencil and paper? Let me give you the website address now. So if you're interested, I'm going to do a couple things. One, if you're inbound to my office at all to see me in an appointment, one of the things we'll do is to find out if you feel that you have any problems in any of those 3 areas. A pain problem, a sleep issue, or energy issues. We may have already been working on any one of those already, but to give you a way of getting relief outside of here and what we're doing, the chip is certainly something I'd like to try for you. So no charge, place a chip, so that you can see if these benefit you at all, and then if they do, you can go order these off of this website that I'm going to give you the address for. If you're not planning on coming to the office, you're too far away, you're going to, hey, I'm feeling pretty good except for this little issue I've got, and I don't want to go see that guy, then you've got to use the website exclusively without any previous inclination as to how you respond. But still, it's okay. Relatively inexpensive. I can get them right off the website. Here's the website address, and here's the part that has its trouble getting across, because I know I've given this slowly before. Write this down. www.doctor, that's not spelled any other way than DR. No DR, period, just DR. Dr. Courtney, Courtney, dot Ciara, CIEAURA.com. Once again, writing it down, are you? Dr. Courtney with a DR and then COURTNEY dot Ciara, CIEAURA.com. That will bring up a website. You'll find my name listed on that website. It's the website that the company Ciara has given me to allow my listeners and others to be able to go and purchase these particular items right off the internet. And you'll be hearing more about this stuff. I say we're nice. We feel good about being, because they're in pre-launch mode. The company has not even launched yet. It won't be launching, I'm told, until March. And but once it does, I think you'll see these chips creeping up all over the place. You'll find them in many pain practitioners' offices for sure. I see the chiropractors absolutely want to sample and try these and see if they get similar results. I've been very impressed with the results. I will say I had my first failure. I keep reporting back to you. Whenever things are going good, I got to report when things are going bad. I had my first one not work on a patient. Now, I'm not so sure that I'm willing to agree with the patient's assessment of why it didn't work, because it was something where the patient fell, and it was so fresh. I mean, it literally, he just fallen, caused this massive muscle strain or whatever it was, and he didn't get any relief. And we'll find out, because we'll give him some additional tips to see with a day or two because there is an absolute tissue reaction that one has to go through. And maybe, just maybe, that could be the explanation. Anyway, I had to report that to you. Got a knock on the door. Who's in the store? Hello and welcome.
Hey, how you doing there, Mr. Courtney?
Oh, is this Cass?
Yes, how's it going?
Oh, Cass, I didn't know how we'd connect. In fact, I thought...
I have no idea. Twice in the same month. It's incredible.
Well, look, I'm so glad that the way the numbers worked out, that you actually got our number here at the station. So were you able to call, or did we finally get a hold of you?
You hunted me down.
We hunted you down. Well, I apologize to your wife because I got her up, okay? She gave...
she was up, but...
geez. Okay, all apologies accepted, I hope, Dr. Ingram.
Yes, we're here.
Dr. Ingram, I didn't tell you. I'm so glad we've now switched gears. I've given that information to my listeners on some other things we were doing here, and I had prepared them rather well. Well, they actually prepared me. I'll tell you this, Dr. Ingram.
Yeah.
Since you were on the show, my switchboard has lit up. Okay, this thing is smoking out there because a lot of people got really interested in what you were talking about with respect to oregano.
Okay.
They ordered the stuff. Our order probably is coming in today because we ordered it too.
So this is very important that dispensaries be set up all over the country so that people can have alternatives in the medical system to the traditional drugs and antibiotics. I do see a lot of side effects to even simple recommendations such as cortisone and particularly antibiotics. I can't tell you how many people get themselves into more of a bind by not knowing what they're treating. Remember we talked about fungus last time?
Absolutely.
And, you got to know what you're dealing with. The first and the most important thing in medicine is to make an accurate diagnosis of the perpetrator or the cause of the disease. And then, in my view, the second thing is, above all, do no harm. Start with something simple that's not toxic. You see, this is how we should be doing it. And you've got some good. What are you bringing in something I think called physician strength?
Yeah, we're going to talk about physician strength. But you know what also was sent to me? I don't know whether you use your influence, but I got a copy of your book, The Miracle of Wild Oregano. And so when you start jumping into this book, you go, wow, this didn't come out in our conversation. And so I got a bunch of questions that I want to ask you because you're the author of the book. Folks, we're talking to the king of oregano. This is the fellow who knows more about the medicinal uses of oregano than anybody else on the planet, and has written multiple books, 22 I think total, and now his most recent, now available, called The Miracle of Wild Oregano. He is an outstanding speaker. He is an author extraordinaire. He's always on the media, TV, radio, other forms of media, and he's so nice and gracious to come and visit us literally twice in the same week. We feel very fortunate, Dr. Ingram.
Yeah, well, this is because of this new book anyway. I don't think a lot of people, they remember the old Cures in the Cupboard, but now we have an additional book with completely different information, The Miracle of Wild Oregano, because since the time when I wrote the Cures in the Cupboard, a great deal of research has come out. And that research has been summarized in the book.
Well, I want to tell you, I have been, as a medical person and science-oriented, I've been very impressed with the kind of footnoting, the bibliography, and the pointing out of scientific experimentation that has backed up what could be considered as up till now. We talk on the radio. We didn't really talk too much about science. I want to say, ladies and gentlemen, you've got to have this book. If you have many of his other books, you'll want this one, The Miracle of Wild Oregano. You gave me, so I don't forget, Dr. Ingram, you gave me a phone number that people could get the book at, and I wrote it down. Then
I can give that out.
Go ahead, give it out.
And then they can get their pens and pencils and scratch the number down because, my assistant, Mr. James over there, he's a good guy. 1-866, it's Italian spice. 1-866. 626 5888 866 626 5888 for The Miracle of Wild Oregano. By the way, any of the Courtney listeners, if they buy both books, they get no shipping. We pay the shipping, the tax. So if they buy, The Miracle of Wild Oregano, the Wild Berry Cure, or The Miracle of Wild Oregano, the Cures in the Cupboard, whatever. Now, this Miracle of Wild Oregano, the science about the destruction of fungal forms, we have a heavy information in there. The destruction of Candida albicans in the mouth, in the vaginal tract, systemically. The destruction of molds. The destruction of, the kinds of molds that cause these lung fungal balls in the lungs, or sort of a ticklish cough, or a pressure in those lungs, or a pressure in the face from the sinus. We have data. And also the dry cough, or the cough that's non-productive. We have good data and good experience to show that when you take the whole crude herb, the oregano oil, the juice as a nice protocol for the average individual, it'll obliterate that. Yeah. asthma too. Asthma too. Yeah, it's a very potent antifungal. You kill the fungus, you get better.
Well, you certainly cite, and ladies and gentlemen, I want to report to you that this book is loaded with personal histories, cases where patients have presented with a chronic, very difficult problem that seemed to elude the conventional medical doctors, and then put on a regime of oregano in various forms and their responses. And so you enjoy reading the book from that perspective. You identify with a case or other cases in there and go, hey, that's me. That guy's talking about me there. So I'd point that out to you. But then again,
in the case history there, I had a woman that had asthma for pretty bad shape because, she's on the cortisone, and that gave her the buffalo hump on the back and all that, and inhalers. And it took about a month with this 35, 40-year case of asthma for the oregano to just obliterate it. I mean, it's finished. No more inhalers, no more theophylline. I mean, that's a good thing. It was the Journal of Pediatric Endocrinology published the fact that those who regularly take inhalers, 35% increased death rate over those who say, no, I'm just going to live with my asthma, take no inhalers or no theophylline. Because those things can irritate the heart, you see. And an irritated heart with too much sympathetic nerve banging, it could suddenly stop, arrhythmia, this type of thing, yeah.
Let me, as I was going through the book, a couple citations here really caught my eye. And they'd never come up before in our conversation, but I'm trying to, and I put these little pieces of paper in here, so I would immediately, if we were so fortunate as to be, yeah, here it is. That's one of my pieces of paper. You're talking about the ability. This is a research done by a gentleman back in 1980, Cavell. He worked at the Pasteur Institute, and this grabs me because, oddly enough, about 2 weeks ago, I was talking to my cousin who's drinking this bottled water, and I always look at the labels. The label is purified water, and I said, you know what? This was in somebody's toilet a couple weeks ago, okay? And she didn't really like the reference, but what happened as an upshoot from that is that next time she went out, it was spring water that she was buying. She wasn't buying purified water. She was an educated person now. What grabbed me is Cavell's work, where back in 1918, they had the ability in utilizing oregano to sterilize septic water. Now, talk to me a little bit about that, because, man, that conjures up one heck of a capability.
Yes, well, in the trenches in 1918, there was all this disease, and there was no sanitation. There was no flush toilet, as you know, at that time. So they were looking for things to treat disease and wounds, and they took sewage water, then they inoculated it with beef broth to get it, as if it's not revved up enough already.
Yeah, to really get it going.
Yeah, exactly. They took about 30 essential oils, cedar oil and garlic oil, onion oil, oregano oil, thyme oil, clove oil. And only a couple of them, really stood out big time. And one of those two was the oregano, because it obliterated you couldn't culture anything out of it. It was a 1 in 1,000 dilution. So for every ounce of sewage, or for every 1,000 ounces of sewage waters, is an ounce of oregano oil. And you couldn't grow anything out of it. It killed everything.
It sterilized that water.
Yeah.
That is amazing to me, and it was a citation that, man, did it capture my eye. And I wanted you to mention it, because it really points out, the antimicrobial component here in a way that I think has a really lasting image.
Think about it. Every time you go into a John, you're inhaling billions of germs, and you spray, these stupid spray toilets we have, spray every kind of pathogen up. You're on an airplane, you're sucking them down. You're in a hotel, God knows what's going there. You're in a room public with a bunch of people. And then you just mentioned we're drinking water here and there and ice cubes, and it's full, like you said, it's filtered toilet water. So, yeah. It's very good, by the way. I love your preoccupation breakers, I must say. so if you came down to the Courtney dispensary, for example, and you picked up a bottle of oil of oregano or some of the capsules, you're protecting yourself. Do you understand? Oh, can I take it every day? It's going to hurt me. Are you out of your mind? The number one killer in this country, if you add up the deaths from cancer, it's not from the cancer, it's usually infection. The people who get complications in hospitals, pneumonia, flu, is probably infection.
Yeah, it is.
Overall. You know?
Very good. Okay, got another question. You have always emphasized, and probably appropriately so, the antifungal component. I mean, our last discussion was there's a fungus among us. This confusion that exists in the conventional medical community to keep treating something with antibiotics, which are antibacterial, when in fact this is more than likely a fungus. And I thought that the hallmark sign, and although you had mentioned it prior in the same conversation, I didn't grab it the first time around, but boy, I got it the second time around. I said, hey, Doc, what's sort of the distinguishing, like, is there any way to know that this is a fungus and that it's not a bacteria? And I'll let you answer the question again because it was so on point. Go ahead.
Well, the way you know is that it's not a temperature, it's not chills, it's not, unless it's extreme, if there's blood fungus, then you might, it's not the malaise. It's more of a congestion, head cold type of thing.
You said sinuses. You said a residing set of symptoms in the sinuses, correct?
In the sinuses, in other words, first of all, your body temperature is cool, generally. Your sinuses are aching. There might be pain behind the eye. One side is stuffed. You can't breathe out of one side or both sides. There's clear drainage. There's sneezy, wheezy, drippy, rhinitis, we call it. And then it can drop back into the lungs, and then we can get the bronchitis. If that gets extreme, then we might get some temperature, but it's not the 105, it's 101, the type of thing. We might get some greenish yellow drainage. It's not always clear. When the fungus really digs in, we could spit up some yellowish junk from the lungs, but it's more of a chronic bronchitis, chronic sinusitis, and it's fungus. But if you want to have some fun with this, let's do an exam on the surface features to see if that person, somebody's thinking now, I've been getting the antibiotics, maybe that was wrong, but let's look at the surface. Do you have toenail fungus? How about fingernail fungus?
Yeah.
On the fingernails, are the fingernail beds flattened out? Do they have big grooves? Those are surface signs of systemic fungus. Do we have vitiligo, which is the white spots? Do we have pityriasis? Do we have itchy skin? Do we have alopecia? Nobody thinks of that. They just think you have to have, thrush. That's the extreme.
Well,
you can even, go ahead.
Well, no, it's just saying the emphasis in our last conversation, because of the title of what we're bringing to them, tend to skew what I, in reading your book now, say, hey, look, this is this oregano, as I now read it, is much more able to handle other kinds of organisms, not just fungi. In fact, it's one heck of an antibacterial agent itself, and that's probably what I want you to speak a little bit about, the fact that, able to handle things like MRSA. My goodness gracious. Give us a little bit of information about that.
Yes, there are a lot of bacteria in sewage water, and we talked about the sterilization.
Yeah, that's the first fact. I hope it's relaying.
But, at Georgetown University, we took quite a number of human pathogens. In one case, 5 big guys, tuberculosis, E. coli, staph, Klebsiella, and killed all of those, right? But then inoculating mice, we killed an MRSA precursor in the mice, which is a penicillin-resistant staph, and it worked as well as vancomycin. The oregano did, yeah. Now here's the important thing. You have a sore throat. You have a bacterial infection. You're doing medical. You can still use the oregano. You use it under the tongue for that strep throat and sore throat. You can take it like every 15 minutes if you have a sore throat. You can use a wild oregano-based spray to spray the room if there's a bacteria, if there's MRSA, if there's concern, and also to spray the back of your throat. You can take, these wild oregano gel caps every couple hours on the hour. So you're using the drops, you're pounding with the gel caps, you're pounding and blasting the bacteria out. For the really extreme cases, like tough invasive MRSA, I will add a couple of other things. I will add the juice of oregano by mouth. I will add this multiple spice, this oregacillin. I will add some of that for the really tough, deep-seated cases like osteomyelitis. For example, deep-seated MRSA. For example, deep-seated candida that's resistant, or even AIDS. I do use that too. Now, let me tell you one other interesting thing. We talked about it, I think, last time. Why don't we, in addition to killing things, pump up the white blood cell activity, pump up the immunity?
Mm-hmm.
I use the chaga for that.
There's the chaga, that birch bark derived extract of mushroom extract, right?
Yeah, yes, it's exactly. It's a birch bark mushroom, and you think about how sterile birch bark is. So that's the best kind of a mushroom, not the ones on the ground. They're okay. I'm sure they're good. But the ones that grow on the trees are the top of the chain. And they are well tolerated. I have a patient that's very allergic to mushrooms. She can take chaga every day. It doesn't make a difference. So it's a very interesting substance, yeah. But
Hey.
use it when the immune system is way down.
Got a caller. They're already knocking on the door. Why don't we let them in, okay? Come on ahead. You're with Dr. Cass Ingram. Go right ahead.
Hi, can you hear me?
Yes, we sure
Yes,
can.
Hi. I listened the other day, Dr. Ingram, and I have, you mentioned the shins in terms of putting the chaga powder on. And I have what I think is a fungus coming out of my legs. I've been having it come out on my face, my underarms, and now it's on my legs. So I have been taking the Oregano for 3 days. I have the P73 and I have probiotics, but it seems to be getting worse.
Okay.
Now, chaga powder should be in my mail today.
Okay, here's the deal for you.
Okay.
It might get, the worse is a good thing. If there's a change, it's a good thing because you know, this thing is exuding out of the system, huh?
Yes.
So pound away. The chaga can be dabbed on these lesions, rubbed on these lesions. There's also a chaga cream now. They just manufactured, I think they've got a couple, 3 bottles, so if you've got a hold of them, you should get that from them. It's very sophisticated.
So the chaga powder, if I do that direct, I don't have to dilute it in anything?
No, direct.
Okay, direct. And
Take a lot of it internally,
okay.
You know, 3 or 4 squirts 3 times a day.
Okay.
And just keep batting at this thing.
Okay.
It's the fact that it's around your underarms tells us that it's probably fungal, because that's a moist area.
Warm, dark, moist, yes.
Yeah.
It's also on my lip right now, and I have
Holy cow!
I have some on my hand, like in between my 2 fingers.
That's definite. How did you? Were you exposed to
well,
something?
I'm thinking about 20-some years ago, I had a parasite, and they put me on a very, very strong parasitic flagell.
Okay.
And it seems like since then I've had, and I've been with homeopaths and one thing after another, working on this candida.
For some reason, it sounds like a candida type thing. Candida loves the armpits.
Uh-huh.
Most likely, the strong antibiotic induced a candida in the intestines.
Well, that's what I was thinking. And then I also have an addiction to sugar.
Oh.
Which kind of, over the years...
Well, that means the fungus is pushing you hard to get the sugar.
Yeah.
You know what? The chaga by mouth will obliterate this along with the oregano and the healthy bacteria. You don't need anything else. I mean, ideally, we can talk more as you're getting better, but wow, what an interesting history.
Great call. I'm glad you did call, ma'am. I hope you got a great bit of insight from Dr. Ingram himself.
Thank you.
Absolutely, absolutely. Thank you very, very much for that call. Other callers who may want to talk to this expert, Dr. Cass Ingram, 412-825-6262. The lady introduces a concept that sort of plagued me as I was reading your book, and so a direct question to you on this subject would be something that I think would be appropriately placed, and then I'm dying for the response. This is such a good antimicrobial. I mean, when you can take septic water back in 1918 and sterilize it, you got one heck of an antimicrobial, because whether it's fungus or bacteria or viruses, they're all in that septic water. But so too the intestinal flora, bacterial, and so
this is a challenge with heavy dose oregano. When you're taking 40, 60, 80 drops 3 times a day, like we did for hepatitis C, this clinical trial we did in humans. You know, we had a couple cases where the bowel got kind of sterilized. That happens with garlic. People who eat 5, 6 cloves of garlic, temporarily everything is dead. It seems to be dead. And then it regenerates. However, when you take the Oregamax, the whole crude herb, it doesn't do that. when you take, however, the high doses of oregano, I always tell people, and I do in my new editions of the Cures in the Cupboard, back it up with some healthy bacteria.
That's the good point to bring in. Yeah.
You know, lots of yogurt, but not to worry about the 2 to 5 drops of the oil every day. We should be replacing those good bacteria regardless. We got enough chlorine and fluoride and poison that chlorinated hydrocarbons, all that stuff kills those bacteria.
All right, that's a good point. Another knock at the door. Come on in the store. You're with Dr. Ingram. Go right ahead.
Hello, Dr. Courtney.
Yes.
One more time, can you give the phone number for the book?
Oh, yes. Well, you want to do it in Italian?
I can do it for you. It's 866, stupid 866, 866-626-5888, 626-5888, whatever happened to those 800 numbers, but they're gone. 866-626-5888.
Get the book. You really enjoy it. You really will.
Hey, thank you very much.
You're welcome.
Really enjoyed the program.
Thank you.
The other thing I want to ask is how to order or where to purchase the oregano. Now, I do purchase oregano, but I want to make sure I have the right.
We're going to talk about that in a second. It's going to be right here, sir.
There is a huge difference, and I'll tell you in a minute, but you can see the Dr. Courtney Pharmacy. You can call 1-800-243-5242. I'm not endorsing. I'm just telling you where I buy the stuff, where I get the stuff.
That's right. That's what I want to do. Now, the other thing that I have heard, and I don't know how much, I heard you talk on the other show about non-irradiated.
Yes. This is very important. You heard Doc talk about the whole crude herb, the oregano in a capsule. That is pure wild oregano from the mountains, and they put on the label before it comes over in the bags on the ship, do not irradiate. The FDA loves to get out its fancy irradiation machine and zap everything. Commercial spices are zapped, not just by the FDA, but by the actual spice makers like McCormick. Not just that. They actually take the oregano, the villagers do, I've been over there while they did it, and cut it 9-to-1 with grass and leaves of sumac trees. That way they can sell it for cheap to the spice people. And so you want the real wild Mediterranean oil of oregano, which is hand-picked and certified wild and non-irradiated and all that. And so, yeah, it makes a difference. The second thing about oil of oregano, which is interesting, oil of oregano, when they grow the oregano in Saskatchewan or California or British Columbia or Spain or these places, it has a different chemical profile, France, and it's not edible. It has to grow on rock. It naturally grows on rock, and then it produces a wonderful, robust profile. And so since I've been talking about it, there's about 40 brands of oregano on the market, and most of them are garbage. But anyway.
Well, that's the important thing, to get the right...
yeah, blue label. Does that help? Blue and yellow.
The other question is, now there's some... there's some talk going around about the post office, and that it's very important to ship supplements by United Parcel. Now, I understand, it's my understanding, the United Parcel guarantees that they do not irradiate.
There's another way you can do it. What I have people do, companies, I have them put a sticker, do not irradiate, on the stuff that goes by the post office. But whatever manufacturer you choose, I'm sure you can request UPS. It's a very good point that they do not irradiate.
Good point, you two. All right.
It does, yeah.
Great point.
FedEx will not guarantee you
I know.
that they do not irradiate.
I love
that
to hear
I've been
that.
able to find, it guarantees it is United Parcel.
Wow, UPS gets our credits today.
All right, for UPS.
Yeah.
Great point to make, sir. I expect that of you, by the way. Very good and stellar. And keep on listening.
Okay, thank you very much.
You're
Great.
welcome.
I think now, Dr. Ingram, is an appropriate time to talk about this physician strength line, because I actually, you were nice enough when you were on the show to send me the copy of the book. I ended up getting some samples, and I go, oh, geez, where are these from? I never heard of this company before.
Oh.
And so,
yeah, physician strength is great. It's slightly strong. It's slightly stronger than the commercial. Than the
commercially available from North. What's the name? What the company we dealing with here?
the North American.
North American.
Yeah.
And I'm looking at North American catalogs. You're right, with the blue and yellow. That's North American. And then I get this stuff with Physician Strength, and it's with when I called the company and got it cleared up. Let's just say for every product there is a Physician Strength product that's just a little stronger that you can't get as a lay person.
Right, because the commercial business is just perfectly fine, and there's millions of people using it. But when you get into the physician, sometimes you can tweak it a little bit, and some things you can make a little bit more potent because it's under the physician's management. So, for example, Thyro Power. A lot of people take the other version, which I do too. But if I get exposed to radiation, flying, and so forth, I'll try to pick up a bottle of Thyro Power because it's fortified with potassium iodide. Okay, so that's kind of a physician thing. The oil of oregano that you have apparently is about just 2.5%, a little more aggressive. So it's a way that the doctor can have something to dispense, to manage patients with, instead of the antibiotics and the cortisone and all the stuff. The wild oregano crude herb that you have there, I think, has just the wild oregano and the Rus coriaria, whereas the commercial one has a little garlic and onion. So there's a few differences that were designed with the physician in mind. That's all that is,
Okay,
same
so
thing. Basically the same thing.
So, Lenny, those, because we had a slew of people that already ordered. Just listening to your last show, I'm expecting that to be in today. Also, if those of you out there who want to make an order, call up. Probably because we're getting the Physician Strength line in here, we'll have to interpret the code because the names of the products change slightly whenever you move from the commercial line to the physician line.
Yeah, it's a great thing to have the doctor dispensing in addition to because the physician can monitor the patient in tough cases like chronic hypothyroidism, chronic systemic fungal infection. That way you can be reminding them about what to eat, the importance of lactobacilli, maybe taking a test, maybe there were some abnormalities in the test parameters and you want to follow that. I think that it's really the best of both worlds for the tough cases to be under the doctor's care. It really is, because they don't know anything at a health food store. Well, they really don't. Even if they're good in terms of, how do we say it, they're good assessment people. Like some of the people in health food stores see clients, and they do a great job. But it's a difference. You have to have the education. Some people need to follow up with testing. And I can take a person, he's been to 100 health food stores, brings me a big sack full of supplements, and straighten it all out in an hour, because we have the training for that. You see what I mean?
Yeah, absolutely. Now, I was looking at the various ways that this oil of oregano comes to you. An interesting point came up, and just wanted to comment on it. Steam distilled oil appears to be the purest way to get this oregano.
Let me tell you something. This is so fascinating about herbs. Everybody's into the raw movement, and we should be. But when we extracted the oregano oil raw with carbon dioxide, which is a raw extract, it didn't kill germs very well. The old traditional way of using hot steam, or steam under a boiler pressure, to extract it produces a killer, a germ killer, because you're trapping all the aromatic oil.
That's the point I wanted you to make, and that is that's trial and error. That's why maybe the other forms of oregano, you say there's some 40 companies out there, they're not minding the extract of this in the way that this North American company is. So
no, you got to know your business.
You got to really know it, and so knockoff versions of this you cannot trust.
The thing about the knockoffs is that they're growing them and combining the oregano in fields. It's horrifying. The profile comes out different. The chemistry is different. Case history. A guy, Mr. S., was scouring the internet and found a cheap brand of oil of oregano by a $100 million American company. He normally used this P73 that the caller talked about, okay? And he decided for his dog to give this other stuff. He diluted it in olive oil. He did everything right. He gave it to the dog, and the dog died. His feet went up and died.
What?
Yeah. But you can give the good stuff that's made from the Rocky Mountain spice because it's food. That's what we get when we buy oregano in Italy or in Turkey or Greece, and those bunches, you're buying it. The villagers go up to the mountains and cut the oregano, and it's growing in between the rock, okay? But the dog died. We analyzed this. It had the wrong chemistry. And, and he wrote me a letter saying, geez, how stupid.
There it is. Got the knockoff variety. And lesson learned. You want to stick with the company because how you extract this stuff, literally, then putting that's why the point also was you can't really take the oil itself. You got to put it in olive oil because the human being cannot tolerate.
Well, we gave it to mice. We gave the pure, even really good quality oregano oil in a pure state without the proper olive oil emulsification, because in nature it's in fatty oil. Then you extract it with steam. It killed our mice, even the good stuff. If you don't manufacture it properly, it's just pure extra virgin olive oil with organic wild oregano from the mountains that's wild, and then it's totally safe. Here's another example. I mentioned to you the cold extract. When you take the pure oregano oil and cold extract it, then that's a good form for skin cancer, because the cold extract it's green in color. It has the flavonoids like quercetin.
Okay.
So we use the cold extract, but we tell people you put it on your age spots, your skin cancers. It's just a difference in approach, that's all.
Well, we got bongos in the background. You've made the show once again, Dr. Ingram. You've allowed the listeners to learn a little more. We're going to bring you back, hopefully, maybe next month, give you a little bit of break from us, and keep on lecturing us and teaching us more, because I think wild oregano is now taking deep root in the Pittsburgh area.
Very, very good, but you really do have to buy the right stuff. And then if you do that, you can use it and keep yourself healthy and prevent. And guess what? You probably will live longer, because if you don't get infection, what's going to kill us,
All right.
Spirits, keep our spirits high, keep the oregano at hand.
Keep warm. Thank you so much for the diligence of being with us today. Ladies and gentlemen, we'll see you on Friday. Until then, this is Dr. Dennis Courtney with Dr. Cass Ingram saying so long for AM Impact on Your Health.
AM Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724